Hello, I'm John Barrett, and I'm one of the faculty members here at the School of Nursing, and today we are going to demystify statistics. Our topic is likelihood ratios. So what are likelihood ratios? Likelihood ratios help you to rule in and rule out diagnoses or conditions. A positive likelihood ratio, a number greater than 1, helps you rule in a diagnosis, and a negative likelihood ratio helps you rule out a diagnosis. That's a number less than 1. So let's take a look at an example. You have a 25-year-old female who comes into your emergency department with an acute onset of abdominal pain. You suspect appendicitis. How do you make this diagnosis? Well, we know at the beginning that a baseline appendicitis risk, so patients who have acute abdominal pain, which is defined as less than 7 days, you have somewhere between 4 and 20% chance that they'll have appendicitis. We call this the pretest probability. So what do you do next? On physical exam, your patient has McBurney's point tenderness. Now, McBurney's point tenderness is in the lower right-hand quadrant of your abdominal region, and that's basically where the appendix is located in most individuals. So does that help you rule in the diagnosis? Well, we know that McBurney's point tenderness has a likelihood ratio of 3.4. Well, that number is positive, but how confident are we now that the patient has this tenderness in that location that they have appendicitis, and then are we ready to diagnose that? Because we know that the treatment is surgery. So are we ready to send this patient off to surgery just with McBurney's point tenderness? Let's take a look at a calculator to help us make that decision. So at the top we have this pretest probability, which is for this patient was between 4 and 10% or 20%, and we're going to just put it right at 10. And we know that the positive likelihood ratio is at 3.4. So let me just move that number up here, somewhere around 3.4, and now we get a post-test probability of about 28%. Let's go take a look at the slides. So now your patient who had a pretest probability of 10% and with McBurney's point tenderness, now after applying that likelihood ratio, you have a 28% chance that she has appendicitis. Are you ready to send that patient off for surgery and make that diagnosis? I don't think I'm quite ready for that. So what else can we do? Well, we can order an abdominal pelvic CT. And if abdominal pelvic CT is consistent with appendicitis, that positive likelihood ratio is 19. That's higher than the positive likelihood ratio of the physical exam finding of a McBurney's point tenderness. Let's take a look back at that calculator. Let's kind of reset everything down here. And we're going to move the pretest probability up now to 28% because that's what the person's probability is after they have acute abdominal pain and McBurney's point tenderness. And let's move that likelihood ratio all the way up to 19. And what does that look like? Well, that looks like about 88%. So you ordered this abdominal CT scan, which showed signs of appendicitis. The likelihood ratio of having appendicitis has increased from 28% to 88%. Are you ready to call the surgery team? I'm ready to call the surgery team. That's a pretty good post-test probability, an 88% chance that this patient has appendicitis. We may be wrong, but I think it's time to call the surgery team and let them make a decision if this patient is ready for surgery. The question, though, is what do you do in clinical setting when you don't have a calculator like this? So let me give you a little bit of guidelines on how to use likelihood ratios. So the diagnostic weights, and these are kind of a general ballpark, is that likelihood ratios negative or under 1 decrease the pretest probability, and numbers above 1 increase the pretest probability. So if you have a number that's 2, you should expect that that increases the pretest probability 15%, and if it's 5, it's 30%, and if it's 10, 45%. And in the reverse, 0.5 decreases the probability by 15%, 0.2 by 30%, and 0.4 negative 45% for 0.1. So as an example, if you had a likelihood of ratio of 5, you would increase your pretest probability from whatever number that was. For this example, we put her pretest probability at 10%, and we'd increase that by 30% or move that up to 40%. So I hope that this clarifies likelihood ratios and how they can be a really powerful tool in the clinical setting. I hope you take a look at this guide and kind of keep it with you, because as you look through things, these likelihood ratios will pop up from time to time in both up to date and in your research reading when you're reading different research papers. Let us know if you have any questions, and thanks for watching.